All right, thank you everyone for joining us this evening. We had a few technical difficulties, but we are here with you all tonight, Wednesday, November 3rd. We have Dr. Eric Sergienko and Dr. Kristina Allen here to give our community a bit of an update on COVID-19, as well as vaccines, boosters, and we're happy to answer any questions you might have. So we'll go ahead and get started. Let Dr. Sergienko give a quick little update on where we currently are with COVID-19 in our community.
Well, good evening, and I will say it's been a while since we've done a Facebook Live, and so both technical challenges, I think, related to our power outage we had earlier today, but also we're a little bit rusty on the keyboard, so we were working with that. And actually, I think the last time we had anything like this is the talk with the doc from my isolation at home. And I've been doing well since then. But as a county, we could be doing better. Since the Delta wave, the inflection of cases started on July 22nd. We've had a peak at the beginning of August into September, and then we're coming down from that. But my concern at this point is that we're plateauing at about 6 to 8 to 10 cases on average a day, which gives us a 7-day rate, if you're looking at the CDC data tracker, well into their highest category, over 300 cases per week per 100,000. And so and you can tell we were a little bit rusty here too in the community too, with people in the office coming in. But as I was saying, we are at a fairly high rate for plateauing. If we harken back to the blueprint for a safer economy, we are 4 times above the threshold that would get us into the purple tier. So during the Delta wave, we have had higher case rates, higher number of hospitalizations, and sadly higher number of deaths than we have seen in the previous 16 months. My other concern is at this point is that not only is Mariposa kind of stalling on decreasing cases, but we're seeing throughout the state that is happening as well. Most notably in our region, Fresno County actually had the second most hospitalized COVID patients of any county in the state after Los Angeles. And that's not per capita, that is raw number of patients. As well, they are starting to see an increase. And then if we look to our neighbors, our neighboring regions, the greater Sacramento area is starting to see an uptick as well, and starting to see an increase in hospitalizations. So because of that, we're concerned that we'll be heading into a surge. We had been talking with the state about a month ago. I think I mentioned it on my talk with the doc, that they were thinking that we would not see an increase in cases until after the holidays, until after Christmas was over. And contrary to that, we're actually starting to see again an increase in several areas, not just the greater Sacramento and the San Joaquin Valley areas, but even in the Bay Area. There were 2 counties that moved back into higher rates from moderate transmission to substantial transmission. So that's kind of where we're at as a county, as a region, as a state. Even looking at us nationally, we're starting to see a slowing down in the decrease of number of cases. So, sort of slowing down, plateauing not only here but throughout the country. And then throughout the world, there's a talk about a variant that has come out of England, the AY 4.2, and the concern that spreads about 10% more effectively than the current Delta strain. Don't know if that's the case, but that's what the early epidemiology suggests. We've already seen one of those cases typed here in the county, and have seen additional cases throughout the region. We'll be keeping an eye on that, see if that becomes the predominant strain. That said, vaccines remain effective in reducing transmission. We know that you're about 6 times less likely to become infected if you're fully vaccinated, that you're still 10 times less likely to get hospitalized if you're fully vaccinated, and 16 times less likely to die if you're fully vaccinated. And that data has been fairly consistent across the last 2 months. We've seen a little up and down with that, but those numbers have stayed in that general range even through the Delta variant. So again, vaccination remains a key way to mitigate the impacts of this pandemic. So that's a lot of things that we've been talking about over the last month or so is boosters. You can now get boosters in any of the vaccine types that we have. For the mRNA vaccines, you're looking at if you are in a specific category, so if you're 65 and older, if you are 50 to 64 and have underlying medical conditions, you should get a vaccine. If you're between the ages of 18 and 50 and have underlying medical conditions, live in a congregate setting, or work in a high-risk occupation such as a healthcare worker, you should consider getting a booster. And those boosters should be done 6 months after your initial dose. Now, again, for those latter two categories, the 18 to 50-year-old groups, you may be able to hold off for a little bit longer, sort of optimize your timing, looking for when we surge and maximizing the boost or the benefit you get from the boost. So those are for the mRNA vaccines. For the Johnson & Johnson vaccine, it's really for anyone who's received that vaccine and is 2 months or greater out from that. And I'll repeat what I have said to the board for the last couple of weeks, and maybe even sooner or longer than that, is there really is solid data that suggests that an mRNA vaccine as your booster for the Johnson & Johnson is more effective than boosting with the Johnson & Johnson, a second dose of the Johnson & Johnson vaccine. So again, that's a recommendation I would make, and you can schedule your booster through the myturn.ca.gov. I'm sure we'll put that in the chat here at some point in time. But that's the best way you can schedule a booster. And again, we'll have those available. Kristina will go into details about the appointments that are coming up. And then the latest thing, and I think the reason it really prompted us to schedule the Facebook Live is that yesterday the Advisory Committee on Immunization Practices unanimously approved a recommendation for the Pfizer vaccine for the 5 to 11-year-old group. That was came after the Vaccine and Related Biological Products Advisory Committee of the FDA also voted unanimously to approve the expansion of the emergency use authorization for that age group for the Pfizer vaccine. So we have already received our first 300 doses of the pediatric dosing of the Pfizer vaccine. It's a third of the amount in the adult vaccine. It's still a 2-dose vaccine, 21 days apart, but they went with a lower dose, recognizing the concerns, and there was lengthy conversation both in the VRPAC and the ACIP about myocarditis in the adolescents, the age group 12 to 18, and looking at the safety data from the 5 to 11-year-old group, there were no cases of myocarditis, and there was one of the discussion points was it's more likely to occur in adolescents. We know that's also true for infections, and actually that was one of the points of discussion, was that we know that myocarditis occurs about 6 times more frequently in those people who are infected with the COVID virus versus those who receive a vaccine. So that was part of their discussion, and so in the risk-benefit analysis, it really favored vaccinating kids versus waiting for a natural infection. So I think that's sort of my update from here, and then I'll hand it over to Kristina for details that I may have forgotten, and we'll go from there.
All right, thank you. Good evening, everybody. It's good to be back. As Eric said, it's been a while since we've done this. I will just add our vaccine clinic days So I'll try to go through this slowly in case anybody's trying to write it down quickly, but it's also posted on our Facebook page and our website, so you can always revisit it. We do have a clinic scheduled tomorrow, November 4th, at the Community Health Center. And we will be offering at all these clinics all 3 of our vaccines boosters as well as flu shots. So if you haven't had your flu vaccine yet, you can also come to any of these clinics and receive that as well. November 6th, this Saturday, we'll be at the fairgrounds from 10 to 2. November 9th, it's a Tuesday, so usually our clinics are on Thursdays, but because of the Thursday holiday, we will be shifting our clinic to Tuesday, November 9th at Community Health Center. November 13th, Saturday at the fairgrounds. November 20th is a Saturday as well, and we're actually going to be doing that as a drive-through, and it will be located here at the HHSA building on Lemmy Lane. November 23rd, also a Tuesday, a shift from Thursday, the Thanksgiving holiday. So November 23rd at Community Health Center. And then also just wanted to give you all a heads up that mid-November we will be scheduling an El Pertel clinic as well. We just haven't solidified a date yet. So that will be coming shortly. Actually, I think I misspoke. November 13th, I wrote down fairgrounds. It's actually in Greeley Hill. So for those of you in North County, November 13th is at the Greeley Hill Community Center from 10 to 2. Sorry about that. And that is our clinic schedule. So if you're interested in getting your first, second dose or your booster or a flu shot, that's where you can come see us for the month of November.
All right. We've got some questions already flooding in, so we'll go ahead and get started with those. First question is coming from Zav. Is it safe to get the COVID booster and flu shot in the same day, or should we wait a bit between those?
So the answer is yes. Previously, when we were giving out administering the first doses of the COVID vaccines, we had told people to separate their COVID vaccine from any other vaccine. And that's because we really wanted to know if a side effect that you may be experiencing was from the COVID vaccine. And after having worked with the COVID vaccine for over a year now, we have a sense of what those side effects are, or the approving bodies do. And so they said, yep, we can go ahead and co-administer. Just you'll get your flu shot in one arm and your COVID shot in the other.
All right. Our next question is coming from Julie. I recently had COVID-19. Do I need a booster?
So the answer is yes, but it's nuanced. Is that what we know is the most robust immune response is someone who has had a natural infection followed by an mRNA vaccine. And typically that mRNA vaccine is 90 days or greater out from the naturally occurring infection. So while we do know that people who either have a vaccination or have an infection have a fairly strong, robust immune response for out to 180 days, boosting your naturally occurring infection with an mRNA vaccine gives you the most robust response possible.
All right. Our next question comes from Terry. Will the boosters be more effective than the first 2 shots, or is it a foregone conclusion that you will become infected with the next variant, but your symptoms can be assumed to be less severe than if you never got the experimental gene therapy posing as a vaccine?
All right, so let's take that from the beginning and work our way back. The mRNA, and that's the important part, RNA cannot go into the nucleolus of the cell where the DNA is. So it can't modify your DNA. So to assume that it's gene therapy would be misinformation or perhaps disinformation. So we have to be upfront about that, is that it's an mRNA vaccine, doesn't go near the DNA at all. It produces an immune response by programming your ribosomes to produce a mirror of the spike protein. That's what creates the immune response that your body will fight off the infection with. As I mentioned, there's like a 6-fold reduction in getting an infection if you're fully vaccinated. So it is protective. And so it's not a foregone conclusion that you'll get infected with either the current variant or the next variant or even the variant after that. And actually, if you continue to boost, if it becomes necessary, again, there will be the reduction in the likelihood of infection. But as you say, some of us will get infected. I was one of those. And I had a mild case, and actually it was kind of interesting. And for those of you who didn't see my talk with the doc, I actually came back to work thinking, hey, I'm over this, I'm feeling better. And only then did I test positive, and came in early so I didn't get in touch with anyone or contact anyone. But it's like, that's interesting, and went home. But when I had my worst symptoms, I tested negative, went home because I had symptoms, because it's always a prudent thing, regardless whether it's COVID, flu, a cold, anything, is to stay home when you're sick. So again, not a foregone conclusion that you're going to get sick. If you do get sick, you're reducing the risk of hospitalization and death, and it's certainly not gene therapy.
Our next question comes from Catherine. Is the Johnson & Johnson available in Mariposa? Rite Aid says they don't carry it now.
Yes, we do have Johnson & Johnson available. It will be available at all of our clinics. And we just received another shipment this week. So we have a good supply currently.
Our next question comes from Sandy. Why are boosters needed?
So boosters are needed because, like the flu, like other vaccines, there's a waning immunity over time. Even things like tetanus you get every 10 years. So the time of the immune memory varies from exposure to exposure, from virus to virus. And what we found with the coronavirus is that it's 6 months, and realistically, as I mentioned, some of us that are younger, not me because I'm actually 58, but those who are younger, who are otherwise healthy, could probably actually push that booster down the road for a bit. We say at least 6 months, but you may want to time it to where there's a lot more activity in terms of transmission, or you may choose to do it now if you're in one of those eligible categories. But again, the idea is we know that immune response wanes over time, and it may just need that boost.
All right, our next question is coming from Carrie. If I have been identified as a close contact, how soon should I test for COVID?
Yeah, if you have been identified as a close contact, you should wait about 5 days. We say 3 to 5 days after your last contact with the positive person. To then go get tested, and we always recommend that you go get a PCR test, which is available at the Senior Center through LHI. Also at Rite Aid offers testing, which is a PCR. So about 5 days is optimal.
Our next question comes from Trish. What would you say to someone who would rather take their chances in hopes that they do not get the virus versus taking action and getting the vaccine and having side effects?
So, we still consistently have about a 1% case fatality rate. So that's a 1 in 100 chance of actually dying of COVID if you get a natural infection. We also know that with just looking at our statistics here in Mariposa, you have an 8% chance of getting hospitalized if you're unvaccinated, whereas it's much less with people who are fully vaccinated. So what I tell people who are considering whether or not to get vaccinated is that, again, not only does it reduce your likelihood of getting sick, it reduces your risk of hospitalization, reduces your risk of death. And then one thing we don't emphasize as much is you're helping your community. By not getting sick, by not being able to infect others, you reduce the impact on other people that may not be able to get vaccinated or have chosen not to get vaccinated for personal reasons or for religious reasons or medical reasons. So you're not only protecting yourself, you're helping your community. And for both those reasons, I would consider getting vaccinated.
Our next question is coming from Carol. Which booster do I get?
So that's a really good question. And I think it matters on what you have. And what I mentioned earlier is if you receive the Johnson & Johnson, I would recommend getting an mRNA vaccine, either the Pfizer or Moderna, because we do know that the mRNA vaccines give you a significant boost over getting the Johnson & Johnson as a boost for your original Johnson & Johnson. Then the question is there any value of mixing and matching your mRNA vaccines? That is, if you received a Pfizer, should you get a Moderna? If you received the Moderna, should you get a Pfizer? And it does seem like there is a little boost there beyond what you'd get if you used the same type of vaccine, not the same type, the same brand of vaccine. So that's called heterologous dosing, and that seems to be beneficial. The one thing that doesn't seem to be better is to follow an mRNA vaccine with a Johnson & Johnson. It does give you a little boost, but of all the combinations, it's probably the least boosting.
All right, our next question comes from Grace. If you are a close contact to a positive case and vaccinated, do you still need to quarantine?
Great question. No, those who have been vaccinated and are identified as a close contact do not have to quarantine. However, we do ask that you monitor your symptoms, be mindful of where you're going, who you might be around, mask at all times when you are around others. And of course, if you develop any symptoms, quarantine immediately and get tested.
Our next question comes from Keith. When will the vaccine mandate go into effect for schools?
Don't know. I think this is actually, and I mentioned this at the school board meeting, is it's hard to make an intelligent response when you don't know what you're responding to. What we do know is the governor at a press conference said he was going to make a mandate. That's the extent of information that we've received, that the school board has received, the school district has received from the state, and even talking with our colleagues at the California Department of Public Health, they have not heard anything more from the governor's office. So what I would say is I can give you a guess. I think the earliest we would see it is July of 2022. Though I suspect it will be later than that because of some things that he did mention in the press conference. One, he wants to do it as an administrative regulation through the Office of Administrative Law. So for that to happen, it has to happen at one of 2 points in the year, 1st of January or 1st of July. If he wants to get it by the 1st of January, then he has to have something done by the end of November, the beginning of December. So that's not going to happen. And one of the things he did state was that he wanted a fully approved vaccine. And that's not likely to happen until at least July, probably later than that. So something to be mindful of, but something that we really can't say when it's going to come down, just probably not in the next 6 months.
All right, our next question is coming from Stacy. I read some about the Delta Plus variant. Is this a concern for another wave?
So right now we still have the Delta wave that's predominating, or the Delta variant that's predominating, and I did mention the AY 4.2, that's kind of the Delta Plus, or one of the Delta Pluses that are out there. And that does seem to be more transmissible, or could be more transmissible, and that could prompt another wave. But what we do know is the vaccine is effective against that particular variant, and as it is against all of the variants that we're tracking at this point.
All right, our next question. If a child between the ages of 5 and 11 has had COVID, will it still be mandatory for them to get the vaccination?
So as I mentioned, right now we're really absent on details, and so I'd ask you to be patient and see what comes out of the state. And again, I've relayed to you what we know about it based on the press conference that happened, and we really have no further details at this point.
All right. Our next question is from Howard. Is it a foregone conclusion that you will get COVID even if you have completed the vaccine series, or does the vaccine completely protect some from infection and still being able to transmit COVID?
So to paraphrase what my answer to Terry, the answer is it's not a foregone conclusion. Even if you look at our population of unvaccinated people, only about 10% of our population has become infected with COVID, and that's in 2 years of COVID being with us, or 18 months of COVID being with us. And so recognizing that non-pharmaceutical interventions, wearing masks, maintaining distance, staying home when you're sick, those are all effective means of reducing transmission. Layer on top of that vaccination, it is not a foregone conclusion. And then what was the second part of the question?
The second part was, or does the vaccine completely protect some from infection and being able to transmit COVID?
So it does likely, I mean, it reduces the risk of you getting an infection, and so it will protect people. It depends upon the amount of virus they're exposed to and the vaccine effectiveness in that individual. So it's hard to say, but yeah, some people will completely avoid infection totally. Just hard to say who.
Our next question is from Jerry. Will the COVID keep mutating into a more deadly form?
So typically viruses don't mutate into a more deadly form, though that can happen. Typically what they want to do is mutate, or what evolutionary pressure does is mutate them into more transmissible forms. And that's what we're seeing right now, is things that spread more effectively. And so I wouldn't necessarily worry about a more lethal virus, but one that causes more disease, and because you have more cases, you have more people that get hospitalized. And then again, more people that die.
All right. Our next question is coming from Keisha. How many reinfections have we had in Mariposa County?
We have had 7 reinfections in Mairposa County.
Our next question is coming from Dina. Who's giving the booster shots in Mariposa?
We are at Public Health. So you can go to our website or our Facebook page to see when the clinics are in November. I did go over them briefly at the beginning of this video as well. So if you want to get to the beginning, 1, 2, 3, 4, 5, 6. We'll have about 7 clinics in the month of November. So check out those dates. There's a couple on Saturdays as well. And you can go to myturn.ca.gov to make an appointment for that booster shot.
Great. Our next question comes from Sarah. Have there been any deaths in Mariposa in vaccinated individuals?
No.
Following question is from Laura. If you can still get COVID and spread it when you are vaccinated, then why don't the vaccinated people need to quarantine and test? Quarantine and test also when they are found as close contacts.
Yeah, great question. So the answer is because they're less likely to get infected. As I mentioned, it's 6 times less likely for them to become infected. So that is a risk reduction that's significant enough to keep them out of quarantine. The other thing is, as Kristina mentioned, is we do ask everybody who is a close contact, regardless of whether they're vaccinated or unvaccinated, to go ahead and test at 4 to 5 days out post-exposure. And then the other thing we tell people, regardless of whether they are quarantined or not, is that if they become symptomatic, they stop and they do quarantine, they do isolate, and they get tested. So someone who's fully vaccinated, who is asymptomatic, is very unlikely to have a viral load that would cause an infection. So that's kind of what we know about that. We also know that people who are vaccinated who do become cases, who become infected, they have the same viral load at about 1 to 2 days out, but their viral load decreases rapidly, and they clear it in about 5.2 days versus about 7.5 days for those who are unvaccinated on average. So they're less likely to get infected, they're less likely to transmit it, and we still ask them to get tested.
Next question comes from Mike. I heard that the PCR tests don't work. Is that true?
No. I mean, I could go into detail, but again, what it's looking for is a strand of RNA that's very specific for the COVID virus. And it's actually looking for, looking for an active virus. And what it's looking for is a low enough number that suggests that you have an infectious load.
Right. Our next question is coming from a different Mike. Correct me if I am wrong, but going into fall and winter, both with cooler temperatures and more inside activities, aren't these conditions more beneficial for COVID to spread from person to person?
So I don't need to correct you, you're right. It is more likely to transmit because, not necessarily because the weather's cooler, but we're in close proximity. And it's, I think that's one of the things that we've learned about COVID over the last 18 months is it both an airborne and a droplet spread, but more effectively droplet spread. So as you get people closer, those droplets that go out to about 2 meters are more likely to hit you versus the aerosols, which hang in the air longer. But even the aerosols hang in the air longer for those 2 to 3 hours in a closed building like this that doesn't have really great, we have great HVAC here, but if you're in an older building that doesn't have really good air handling, you can have that particle hanging in the air and you can suck it in and not even know who gave it to you.
All right. Next question is from Ken. I heard there are people who are active cases, but they aren't telling you. Can you do anything about that?
Unfortunately not, but what we can ask is that people do the right thing and stay home if they are sick or test positive with a home test kit. And our information team has done a great job at putting information out on what to do if you are sick or have a positive result. So we just hope that people adhere to that and do the right thing.
All right. And we do have a little bit of follow-up question on the vaccinated and quarantine. If it is possible for them to get it and spread it, would it be irresponsible to not quarantine and test?
So again, we do ask them to test. We'll say that over and over again. And I keep hearing that, well, why don't you test them? And we ask them to test at 4 to 5 days. Again, regardless of whether they're symptomatic or asymptomatic, but again, because vaccinated people and even people who are unvaccinated, asymptomatic is less likely to transmit, but even more less likely to transmit if they're asymptomatic and vaccinated. So again, the most important thing that we can tell a fully vaccinated person is that if they're symptomatic, to stop where they are and then get tested at that point.
Next question comes from Jill. What kind of reactions are people reporting from the boosters? Similar to the type and severity of reaction they had to the first dose or doses?
Anecdotally, just from the people I know who've had boosters from us, have reported lesser, if any, symptoms at all.
And that's been pretty consistent with the reports that we saw from the presentation for booster doses from VRBPAC and ACIP. Again, less severe and fewer severe adverse effects reported.
Next question is from Jerry. When we get tested, are you aware of the variant we may have? And if so, can you let us know?
So one of the challenges with having the surge that we had with the Delta wave is initially back in, say, June, maybe even early July, 10 to 15% of all samples were being sequenced so we can figure out what the variant was. At this point, we probably get only 1 to 2 of our samples that are sequenced every week. And then by the time we actually receive those sequencing results, that case is out of isolation. And to be honest, all of them to date, except for one, have been Delta. So I would just assume at this point, if you haven't heard from us, that it's a Delta variant. And if it's something else, we would probably let you know.
Okay. Next question comes from Marcus. What is being done about the cases in the schools?
So when there is a school kid or staff member, teacher, anyone in a school setting that does test positive, our case investigation team does include the school nurse and her team. So we work very closely with them, meet with them every morning, and go over cases for the day. So they do their case investigation and contact tracing. And the kids and staff are placed into isolation and quarantine as appropriate. We do track them carefully about what classroom they're in or what activities they may participate in. And once we reach about 25 to 30% of a classroom or a sports team that has been infected, we do usually make the decision to close that down, the classroom or the sports team or the school, whatever it may be. for a period of time so that we can stop that transmission as fast as possible. So we work very closely with the school district and the school case investigation team to make those decisions.
Next question comes from John. Next question comes from John. I see a lot of talk about VAERS. Can you explain what that is?
Sure, it's the Vaccine Adverse Effect Reporting System. Comes out as VAERS, and it's a voluntary reporting system for anyone who wants to report an adverse reaction. And I will say that a lot of people say, well, there used to be none, and now there's cajillions or hundreds of thousands of reports. And that's really because this has become the most monitored vaccine in the history of vaccine rollout since the 70s. Every physician, every practitioner who's administered a vaccine has received a notice that mandates them to do a VAERS report for any adverse reaction, even if it's not related to the vaccine, but is in a timeline with the vaccine. And so VAERS is this highly sensitive but not very specific sentinel surveillance system. And it's part of a nested surveillance system to look for adverse reactions related to any vaccine, but in this case, the COVID vaccines. It's layered with something that you may have been offered with your vaccine, which is called vSafe, which is an app that checks in with you on a daily basis initially, then a weekly basis, then a monthly basis, out until you tell them to go away on any adverse effects you may have. And there's also the Vaccine Safety Data Link project, which is based out of emergency departments that look for adverse reactions. And that's also nested with other electronic health records to look for adverse effects. So as an example, when we talked about myocarditis earlier, that was actually picked up through VAERS as a signal. And then that allowed the physicians at the FDA and at the CDC to do this deep dive into the VAERS database, but also look at the other databases to see if there's myocarditis. And out of that, they identified a small number, I shouldn't say small, but 555 out of several million doses of vaccine, and then we're able to make a risk-benefit analysis based on that. So VAERS is important in identifying that signal, but it's not specific. It requires the other databases along with it to make that decision of how significant the adverse effect is.
All right, our next question comes from Andy. I've had 2 Pfizer jabs, but I like the numbers of Moderna. Can I switch to Moderna after 6 months? And would I then require 2 shots?
No, you would not. Yes, you could switch, and no, you would not require to restart the series. You just get a boost with the Moderna.
Next question. Are you tracking severity of symptoms? For example, asymptomatic, mild, severe, critical, death?
Yes.
Yes.
And we do put out data on hospitalizations. And when we created our database, we created, using an Excel spreadsheet. And so that we can look at sort of severity based on a qualitative field, but we really don't have a really good way of extracting it. So we can tell you hospitalization, we can tell you death, we can even tell you ICU versus medical surgical, but I can't tell you, well, this person had really bad symptoms at home versus someone who just had a snuffly nose.
Right, next question is coming from Gina. Please explain what the under investigation means in your status reports. Aren't people asked when they test if they are vaccinated or not? And when do we find out about these under investigation cases, and when and where are they reported?
A great question. So under investigation means that our case investigation team is still trying to reach that individual. And when those, are updated, they are updated on our county website in the case reports section of our COVID county website. I will say that our team, because our numbers are so high right now, we do try 3 times to reach somebody. If that's by a phone call, a text message, an email, whatever form of communication we have. We try 3 times. After 3 times or 3 attempts at reaching the person, we do change their status to no response, which means just that. We never got a response from that person. I will say if we have any suspicions that the person is not well enough to respond, we do work closely with the sheriff's office as well, and they've been able to go do welfare checks for us. We haven't had to do that a lot, but if we do have that suspicion, we don't hesitate to reach out and ask them to go check on the person for us. But under investigation means we're still trying to reach them. Once 3 attempts are made, we change that status to no response, and all those updates can be seen on our county website COVID information page. That was just linked for you there in the chat.
And I'll say it's really pending investigation because we really need the cooperation of the person we're trying to get hold of the case. And so we do have people that hang up on us. We do have people that cuss us out. I will tell you the contact tracers, the case investigators just prefer that you don't answer if that's the attitude you're going to have. But again, those are under investigation because we've not been able to confirm information with the case. That's the appropriate thing to do.
All right, our next question is how many breakthrough cases have we had in Mariposa County?
So we've had 183, and I thank Liz for digging that information up for us really quick. I would have guessed around that number, but 183, and again, most of them have not required hospitalization. I want to say we've had 1 or 2 that have required hospitalization out of 183 as compared to our 8 to 10% rate for the unvaccinated.
All right, and this one's not a question, but I wanted to let Dr. Allen follow up about case investigation and contact tracing. We have a comment here that when this individual had COVID, no one followed up with them to find out about severity. Can you share a little bit more about case investigation and contact tracing?
Yeah, I'm sorry to hear that. We do have a survey that goes out, so I'm not sure where the breakdown was there, but we do use a system called CalConnect, and I think this is a good time to highlight that as well. The cases, when they're given to us through the state system, are put into the system called CalConnect. And that system, if you have a phone number associated with your lab result, it will, or an email, it will text or email you to fill out a survey. So you may see that come across. It is legit. It's not a scam. It will say it's from CalConnect, and you can click the link to fill out this survey. It gives our case investigators a bit more information before they give you a call. And then what that does too is gives you the option to opt in to a daily check. And so then that system will text you daily or at the frequency that you wish to check on you, see if you have any needs. Some of those needs include grocery pickup, medication pickup. We will do those things for you while you're in isolation. And so there really is a benefit to answering the call or the text when we do call. We're not only checking on you and the severity of your case, but also if you need anything that we can help you with. So we have other services to provide. So that will check on you daily as well, and our case investigators get notified once you've answered those surveys, so we can check on the answers and see if there's anything we can do for you.
And I will follow that up with some good information too. If you have questions for the case investigation or contact tracing team and you're an active case, they are very, very receptive and want to help get those answers. So don't hesitate to reach out if you haven't heard from anyone.
Yes. Thank you.
Our next question is coming from Laura. It's a bit long. Do they have percentages of who is testing? What % of all patients who are tested are vaccinated versus unvaccinated? I know LHI asks when registering patients if the person is vaccinated or not, but it would be interesting to see how many that really is. I'll let you answer that and then the next part.
So the answer is yes, we can pull that data, but the thing I want to, sort of the data that you get from LHI is solid, but you also have to sort out not everyone who tests at our LHI site is from Mairposa, and not every Mariposan tests at the LHI site, so you've got to dig through that. And then that's only one source of data, so we get people who are testing at Rite Aid, at other pharmacies that do testing. We do test at the schools, And then we've got people who do home tests. So there are things that we will never capture. There will be gaps in the data. So even if you think it's a tight, perfect system, it isn't. But yeah, we can pull the LHI data.
And to follow up on that, who's to say that the reason you are 6 times less likely to get COVID if the 6 times less likely are unvaccinated versus, 6 times less testing are unvaccinated versus vaccinated?
So that is a great question, but again, they're positive cases, so we get to look at them retrospectively and say who's vaccinated, who's unvaccinated, and then we can look at it in terms of population dynamics. And we're looking not just at us, but at a broader spectrum of the entire state, and so things smooth out the larger the population you have. I will say that in terms of, there is a possibility of selection bias for people who test, but I think it tends to favor people who are vaccinated who test, and then they test negative. As an example, Kristina and I would test regularly. We're both vaccinated, and we're both, except for once, negative.
Our next question comes from Pete. How is our region's hospital ICUs doing?
They are managing. We are not in surge. We're not really even close to surge. The concern right now is that the hospitals have both COVID patients and non-COVID patients. We're seeing, people catching up on procedures that were pushed off that require ICU beds, that require medical surgical beds. We're seeing the system strained, but not in surge. And the real challenge is not beds, but staffing for those beds. You may have heard a lot of healthcare worker burnout over the last couple of waves of Delta, and people just up and leaving nursing careers, leaving their jobs as physicians, retiring, simply because they're tired. They have not gotten a break over the last 18 months. And so again, sort of getting back to one of our fundamental messages, do the best you can to help out our healthcare workers. Wear a mask, get a vaccination, do what you can to break the chain of transmission, get vaccinated.
All right, we've got a few questions in one, so feel free to ask me to repeat it.
Hey.
What is the timeline for VAERS reporting for doctors or hospitals? If I come in and get diagnosed with a blood clot or have a heart attack 3 months after a dose, would that be reported by the physician? When is that cut off?
So there really isn't an arbitrary cutoff. If the physician feels like it's related to the vaccine, that person can put it in VAERS. And actually, if you feel like it's related to COVID, an individual who is a patient can put something into VAERS. And that's actually created, I think, a number of people putting their own symptoms into VAERS. And, that's appropriate. And then again, if it creates a signal, then that gets investigated.
All right. And we've got our last question in here coming from Jerry. Can we get tested too much?
I'm going to say, as an individual, can you get tested too much? Probably. I mean, there's no harm in getting tested on a daily basis, even if you wanted to do that. But the question is could that test be more efficient use of resources than someone else who needed that test? So again, we've got lots of testing capacity right now, but it's not infinite. It is a finite resource. We don't want to use it up. We don't want to stress it too much. So again, what I recommend to everybody is if you're in close contact with the public, if you're working in the hospitality service, get tested on a recurring basis. If you're a healthcare worker, get tested, but not necessarily every day, but on a recurring basis.
All right, that was our last question. Do either of you have any last thoughts you'd like to share?
So I saw a comment up there, and I have to respond to Robert no, they're up and leaving. There are people who are leaving because they're just tired. There are people that are getting fired and this is a question that nurses are not just up and leaving. I just have to disagree with that, is that the data shows that about 3% of nurses are being let go, and that's unfortunate. I will say, in talking with our partners at JCF, they only had to let 2 people go. So it's a very small number out of, it's 1% of their workforce. So again, people are just tired.
And I would just add, it's not just the doctors and nurses at hospitals, it's also the public health professionals at your local health departments. We are tired too. So the more you can work with us and be kind, just remember to be kind. We really appreciate it.
All right, as always, thank you everyone for joining us this evening. We really appreciate it. We do know that this was a little last minute compared to our normal Facebook Live, so thank you for joining us. Please feel free to share this with your friends and family. We will have this on our Facebook page, and we will work to get this uploaded onto our website as quickly as possible. If you have any questions that weren't answered, or you want any clarification, or anything else comes up, please don't hesitate to reach out to our COVID-19 information team. You can send us an email at mariposacovid19@gmail.com, or you're always welcome to call or text 209-259-1332. Thank you all and have a wonderful evening.